Hello, and thank you for watching our presentation. Today we'll be presenting about the disease necrotizing fasciitis. Etiology. The bacteria that causes necrotizing fasciitis is called Streptococcus pyogenes, or occasionally known as Group A streptococci. Streptococcus pyogenes comes from the Greek words meaning chain of berries and pus forming. It is called that because streptococcal cells tend to link in chains of round cells, and a number of infections caused by the bacteria produce pus. To the right, we can see a photo of Streptococcus pyogenes at 900x magnification. S. pyogenes is of coccus morphology, gram-positive, and non-modal, meaning incapable of motion. It has a hyaluronic acid capsule, which helps the bacteria to avoid white blood cells that are designed to find and destroy bacteria. Group A produces streptolysins O and S, which cause lysis, or in other words, disintegration of a cell by rupture of a cell wall or membrane. It also secretes exoenzymes that break down and cause damage on tissues. Specifically, it secretes hyaluronidase and streptokinase. Hyaluronidase digests hyaluronic acid, which is the substance that holds cells together. Streptokinase dissolves blood clots and speeds up the invasion of damaged tissue. Reservoir. It turns out the only significant reservoir of Streptococcus pyogenes is the human body. According to Microbiology Fundamentals, a clinical approach, this bacterium is carried as normal biota by 15% of the population. As found in the book Streptococcus pyogenes, Basic Biology to Clinical Manifestations, it says, while Group A streptococci are known colonizers of the oropharynx, genital mucosa, rectum, and skin, especially at the site of lesions, rates of carriage in present-day populations are poorly understood. Studies examining carriage rates in healthy adults suggest low levels of carriage, typically less than 5% and 1% for throat and vaginal/rectal carriage, respectively.
Now let's talk about the transmission of necrotizing fasciitis. Since 2010, it is estimated that about 600 to 1,200 cases of necrotizing fasciitis occur yearly in the United States. It is most commonly transmitted as the bacteria enters into the body through a cut, an abrasion, an insect bite, a burn, or a wound in the skin. That is the main way that necrotizing fasciitis is transmitted. It's not communicable or contagious, however, it is spread through the sharing of objects with an infected person, or if the saliva or mucus of an infected person enters into the body of another, which, like I said before, is mainly through an open injury. You may also be at higher risk for developing the disease if your immune system is not functioning at its full capacity. For example, those with HIV or cancer are more susceptible to developing necrotizing fasciitis because their immune systems are not functioning at full capacity. This disease was more commonly recognized during the Civil War because of all the open wounds and of the soldiers and the close quarters in the hospitals, so it was much easier for the disease and the bacteria to spread from person to person. Once the bacteria is inside the body, it is very important that medical attention is found quickly because the infection spreads so quickly. And as you can see in the image on the screen here, you can see that the tissue is starting to die here on the leg, and then it's spreading down here. You can see the discoloration where it hasn't quite reached the surface yet, but the bacteria and the infection is already spreading.
All right, now for a clinical connection. This man was using narcotics through intravenous access in his left arm. He was sick with Streptococcus pyogenes and didn't know it. He would lick the needles to make it go in easier and contaminate it with the bacteria. Introducing the bacteria while his immune system was already weakened from the use of drugs resulted in his arm developing necrotizing fasciitis.
Symptoms of necrotizing fasciitis, they sometimes may be confused at first with the flu, and people may think it's not that big of a deal because It may even seem like a pulled muscle or just swelling on an area, but over time you'll see the disease will begin to develop, and that affected area will become very painful and red and even can form into a bump. The pain at first may feel worse than it actually looks, and so people would think, oh, you're overreacting, but it really can be painful. And as the infection starts to grow, the skin may change in color. It may turn red, purple, with black dots, just like right here in this picture. It's discolored. Bumps or blisters can form, and some may even ooze out pus, like as these ones are open, as you can see. And the skin can start to crack, as in this picture as well. On top of this, you may have not only the affected area, like this picture, but you may have the flu symptoms on top of that. So fever, chills, nausea, fatigue, and vomiting. And so this may all occur at once.
Necrotizing fasciitis is commonly known as the flesh-eating disease and is quite disturbing if you haven't noticed from the various photos and slides on our presentation. The name necrotizing fasciitis actually means causing the death of tissues and can be deadly in a very short amount of time if not treated. So in the case of an infection, prompt antibiotic treatment and surgery are imperative to prevent further growth or spreading of this infection. First, the patient will be injected with antibiotics through an IV. If the antibiotic does not reach all of the infected tissue in time, then the doctor will begin surgery in order to remove the rest of the dead and infected tissue. And this will prevent further spread. So although necrotizing fasciitis can be caused by multiple types of bacteria, the most common form of bacteria that causes it is Streptococcus A, and it is the most common and the most easily treated because it is so mild compared to the other infections. So altogether, the treatment of necrotizing fasciitis is imperative, and it is so important that you find treatment quickly.
So there's many things that a person can do to prevent contracting necrotizing fasciitis. The first thing is when you do have any open wounds or cuts on the body, you're going to want to take care of them. You want to keep those wounds clean and sanitary and cover them with a Band-Aid in order to prevent contamination. Next, when you have an open wound or cut, you're going to want to avoid going in areas that can contaminate or spread that bacteria to others, such as hot tubs, pools, water where other people can contract it. Another thing that you can do to prevent the disease is that when you do have a cut or wound that's questionable for infection, don't hesitate to seek first aid and see a doctor and get it checked out by a medical professional. Also, if you have any flu-like symptoms or muscle soreness that isn't going away on top of a cut, like with that cut, you're going to want to again, go seek professional medical help. And this can prevent the start of necrotizing fasciitis or prevent the stop and spread of it. And lastly, the most important thing a person can do to prevent this disease is to follow good hygiene practices, such as washing your hands. By keeping your body clean and rid of any harmful bacteria, you can prevent the chances of contracting a harmful disease and allowing that bacteria to grow or contaminate within you.
Okay, now that we have you all scared, let me tell you the likelihood of becoming infected. According to the Center of Disease Control and Prevention, since 2010, there have been between 600 and 1,200 cases of necrotizing fasciitis in the United States. This is quite the contrast when considering that there are several million cases of strep throat each year, which is caused by the same bacterial group. Just take a look at the graph. Only a sliver of cases of necrotizing fasciitis compared to the daily occurrence of strep throat. Necrotizing fasciitis is an extremely rare disease with only 4 out of 100,000 people getting the illness but the mortality rate for those who get it is between 25 and 35%. Twice as many males contract the disease than do females, and the mean age for the disease is 38 to 44. So, time to wrap this all up. Necrotizing fasciitis is caused by exposure to gram-positive Streptococcus pyogenes through mucus of a sick person, then through point of entry from a surgery, a cut, or a scrape. Normally, the body can fight off bacteria like this, but if the immune system is weakened by cancer or other disease, the person is at much greater risk. Early signs can be mistaken for the flu, but the hallmark sign is intense pain and tenderness around the site. Treatment requires antibiotics and surgery. To prevent it, proper cleaning of wounds and washing your hands regularly. And overall, necrotizing fasciitis is very dangerous with a high mortality rate, but is extremely rare to contract. So if you don't believe us, here's all our citations. And see if you can't say necrotizing fasciitis 3 times fast.